I am Dr. Maya. I'm a plastic surgeon in Washington DC area. And we're going to talk about lower eyelid surgery, lower blepharoplasty, together with a combination of procedures to improve this area. So what are the common concerns in this area? Usually break down in 4 things: fat pockets, hollowness, lack of cheek support, or skin concerns like skin discoloration or excesses. If you just have fat pockets in the area, so puffy eyes, we can do Scarless blepharoplasty. If you're young and you don't have excess skin laxity, or if you don't have a lot of discoloration in the area, a Scarless blepharoplasty can be the best option for you. An incision that goes inside the eyelids where I can remove the fat pockets, and the downtime is minimal, about 2 or 3 weeks of swelling and bruising. It's very rare that patients only come here with concerns about fat pockets. The majority of patients also have hollowness below the fat pockets. The junction between the eyelid and cheeks usually needs some extra support. I usually recommend doing fat grafting nanofat to this area, where the hollow areas is filled with nanofat and fat. These patients usually have lack of volume on their cheeks. Fat graft is the ideal treatment for that. It improves contour like nothing else. If you have skin laxity or skin discoloration, we can either do CO2 laser, chemical peels, or sometimes I have to remove skin. So each patient has different concerns and we have different treatments. That's why a consultation is super important to address your concerns and see your desires. We are here to help you and guide you through the whole process. So if you have any questions about treatments for the lower eyelid area, you can call us. We offer virtual consultations and also in office with me and my coordinators.